The U.S. government theme for the World AIDS Day this year is the power of partnerships. And as the U.S. Congress works to renew the Leadership Act against HIV/AIDS, NGOs working in Africa advise that strategies to fight the AIDS pandemic should be made by recipient countries, since they are more in touch with their local realities. Dr. Theogene Rudasingwa is the Vice President of PANGEA, a global AIDS foundation. He says that countries that receive PEPFAR funds need to make their own decisions regarding the AIDS strategies and how it should be spent.
You might well know that PEPFAR is probably the largest contribution to resourcing and funding work on HIV/AIDS worldwide. Of course, right now we are thinking about a 30 billion kind of funding over a period of 5 years. And so it's very important that PEPFAR is put on a sound footing that at the end of the day makes impact on the lives of the people suffering from HIV/AIDS. And so while we talk to congressional leaders, we tell them that first of all, the process, the PEPFAR process has to be country-driven, meaning that the countries who are the recipient of this funding must be able to be in the driver's seat to be able to make the decision. To make the decision.
At this point,
yes.
Who makes the decision?
Well, it's already, I think, there is a shared decision-making process, but that tilts more towards the people who give the funding.
Okay.
And so what we are trying to say is that the countries that are the recipient of this money must be really effectively in the driver's seat.
PEPFAR has been criticized by health experts who question the effectiveness of the policy that requires more than a third of the funds to be directed towards abstinence-only programs.
The same kind of criticism that you can make, for and against PEPFAR are the kind of criticism that, of course, have been in existence for a while on how effective aid can be and what needs to be done in order to make aid more effective. And so the concern that we've tended to have is that sometimes you have this kind of funding through bilateral means or multilateral means, but at the end of the day you find that the countries that are the recipients do not really contribute a lot in the decision-making process. Right. And now, we are saying that since they are the beneficiaries, then they have to be involved in the process.
Why is it important that they make the decisions?
It's important because that's the only way to make lasting impact. Because remember, whether it's PEPFAR or Global Fund money or aid money generally, is not money that will always be there. There will be a time when there will be no PEPFAR. There will be a time when there will be no Global Fund. And the question of sustainability becomes a central theme in whatever we are trying to do.
Dr. Rudasingwa says that the HIV/AIDS epidemic continues to grow, and millions of people, their families and their communities are now living with HIV. He says that to effectively tackle this epidemic remains one of the world's most pressing public health challenges. For Voice of America, I'm Jackson Vunganyi.